So first of all, we did finally get a dashboard on our website. I'm going to take you out to that dashboard really quickly, but then I'm going to use my PowerPoint charts and graphs. So if we click on this, we will see basically if you go to our website, which is hd.ingham.org, so you don't have to memorize this whole thing, and then go to our COVID page, you will see a link to this dashboard, which is now up. So, you know, you can basically flip here by cases by sex percent, cases by sex number, race percent, race number. Down here you can get both a rate and a case range. And I think there's one over here too. Here's your cumulative cases. So just look at these different tabs down here and you can see basically the data that we put on this dashboard. So much of that is the same data that I share with you every week by PowerPoint. So here we go. We are at 392 cases and 9 reported deaths. 20 of those folks are in the hospital, 4 in ICU. We've been holding steady at 4 in the ICU for quite a while here. And so we have 108 recovered. We've been monitoring a whole bunch of people. 236 of those are active and 379 are complete. So just a graph that shows you the same thing. We now have added a cumulative case count graph. This will never go down. You won't see an apex and down the other side. So what you're going to want to do is look at that to flatten out for, you know, slopes to start changing. See the slope here compared to the slope there. So that's what we're looking for in a graph like that. Here is our daily count curve. I'm going to show you this way, and then I'm going to talk to you a little bit more about how we massage the data in order to get past a lot of this day-by-day jumping in order to see what the true trend is. Because anytime when you're dealing with numbers of, like, say, you know, 5 to 10 and it changes, then you're just all over the place. So we want to figure out a way to smooth that out. Important as cases go up is for us to also look at what are our percent of positive cases by day as a total of the number of tests that were done that day. So if we have increased testing, it would also make sense that we might have increased number of cases detected. Is that really an increase in transmission in the community, or is that a result of increased testing? So that was one of the other CDC guidelines, in addition to a 14-day decrease in daily incidence, is that you might have to look at a 14-day flattening out or decrease of the percent of positives each day as testing potentially gets amped up in your community. And we do see that happening in Ingham County. So our percent positives per day are lagging behind. We get that information from the state. So they're only up till the 22nd. So we can't do any direct comparisons very well yet, but I want you to see what that looks like side by side. So side by side, new cases per day versus percent per day looks like this. One of the other things that you want to do is start to create rolling averages. Rolling averages take 3 days, puts them together, adds the average, and then moves 1 day forward every day and calculates a new 3-day rolling average. That gives you a smoothing. Now, what you can see in this rolling average, and keep in mind, again, that that my rolling average, or my numbers for, I'm trying to move you, you're all in my way here. Basically it is, this ends on the 21st, which is this day right here. So we do not have this data yet on our rolling average curves. So that one was 3-day. This one is 5-day. This one is 7-day. So you can see, even though this day right here, the 22nd, is the last day that's in, actually the 21st, the last day in this curve, that this does tend to smooth the curve and show this downward trend. Although again, I'll caution you that these numbers right here are not in this chart yet. So we're eventually going to have those charts side by side. The press briefing, media conference that the governor had today Dr. Caldoun did talk about using 7-day rolling averages or even 14-day rolling averages. Been waiting to kind of see, as I put these 3 and 5 and 7 days in, which ones they're going to go with. And there are different reasons and metrics for using a different rolling average. But what the rolling average does is allow you to smooth out these jumps in lines, so that, compared to, curves a graph that looks like this, it's much easier to look at when you look at a graph that looks like this. So this is our cases by zip code. We continue to see cases, basically the highest frequency of cases in the 48911 zip code, and they are for sure distancing themselves away from the others in terms of total case counts at this point in time. Keep in mind, we do have a higher population in that area as well. Nonetheless, this is what we're looking at in total number of cases by zip code, where that 48911 is now in a new category with the 48910 and 48823 being in a category, several down from that. I think they're in the 41 to 50. That looks like this by rate. So again, when you look at rates in very not densely populated areas like down there in Onondaga, it doesn't take very many cases in an area like Onondaga to create a rate that's quite high, because their population is very low. So when you look at it this way, you have Mason, Dansville, and 48911 in kind of the same range and some little, but keep in mind also that even though we created this rate graph for you, when numbers are very small, like less than 20, calculating rates do not have a lot of, the confidence interval goes off. So, you don't have as much confidence in the data, and so it's always important to also go back to the raw data counts while numbers are low in certain areas. Certainly in these areas, we have now enough cases for rates to be probably relevant. By sex, we're still at 50-50. In age groups, we continue to see that 50 to 59 age group, our highest percent, and dropping off in the older age groups and the younger age groups. Keep in mind, the bulk of our population also fits in that group. We start to have fewer people as we get older, and we have fewer younger people as well. So here is our prevalence rate by race. And so it shows you now we're about almost 3 times a higher rate in our African American population compared to our Caucasians. That looks like this way, which is again why we calculate in rates, because you'd say Caucasians are the highest hit because there's 53% of them. But as a representative of total population, it's important to go back and look at it this way and realize that we have a smaller population of African Americans, and we are disproportionately impacting our African American and other people of color populations. Hospitalized, 94% are home, 6% in the hospital. That has been fairly consistent for us and is a really good number. So that has been a positive, as well as basically our recovery rate now at 28%, with 4% in the hospital. We've got about a 2% mortality rate right now, based on what we have the ability to test. So that is that. So I don't have a lot specific beyond that today. I figured you might probably have a lot of questions about the governor's new order. I think, as always, we need to be, where did you go? We need to be talking about, what is it that's going on in our populations of color. And so I just would like you to all to think about this. And that is that, this is systemic in our country. Basically, when it comes to disproportionate impact on our people of color, and it's not anything new. It doesn't have to do specifically with access to care or access to testing. It has to do with a lot of social and economic considerations and things that are undergirding the health of our African American population in many, many metrics across this country. And when you think about it, social distancing is a privilege. Staying at home is a privilege. So what is it that's happening with our African-American population? They're in crowded housing. They're using public transportation. They have inherent stress from being Black in a society that has made them vulnerable. And it's important that we realize that they didn't just become vulnerable. There are certain things that have happened over the course of history in this country that have made them vulnerable. So it doesn't just happen. Outside of access to care, this is a reality. And who are we making vulnerable right now? Those who have essential jobs. And these aren't just first responders and healthcare workers. There are people at Meijer, Target, Home Depot, sanitation workers. The list goes on and on regarding who is out there regularly right now, rather than being able to stay home and telecommute or be paid, or even have a savings to weather the storm. Our hourly frontline workers in a whole lot of sectors are out there. I don't think we have to guess that if we took a statistical look at who that is right now, it's probably disproportionately people of color and certainly disproportionately people of low income. So we really need to get our heads around that fact, that this order and these orders to stay home and stay safe were absolutely necessary and absolutely the right thing to do. And at the same time, being able to stay home and being able to stay safe is also a privilege. So we have made vulnerable, again, a population of people via an order that had to happen. But we just really have to get our heads around that. My son, Kyle, works at a Lowe's store in another state. And he's my only little one and he's not little anymore, he's 28, that I can't reach out and protect right now. My daughter's a school teacher. She's home. She's being paid. She is now, teaching online and all that sort of stuff. Her husband is a Meijer corporate employee who is at home, working from home, as am I. My children, my grandchildren are safe. My daughter and her husband are safe. My son is out there every day. And some people, and it's a privilege that he's the only one that I have to worry about that way right now. So that's another privilege. There are people that have entire families of people like my son, Kyle. I had this exchange with him via text where they aren't, he's out in the Las Vegas area where they're about to make him a giant experiment, apparently. But he said this to me when I was telling him that I was glad he was safe. He said, and I told him, I said, so many other people are being paid right now while they stay home and telecommute, but so many people like you only get paid if you work, and it's very tragic, but it's the reality. It's the reality of what we have to do, and it's the reality of what we have done. So what he said to me is the downside is a lot of people see this as a mandatory stay home time as the perfect opportunity to go to the hardware store for fun home projects or just pass the time. And luckily he's not on the sales floor, but it's disappointing to see people go out so much. Now he's not a person of color, and so this isn't about him, but it's about entire families and communities who are out there working in the public right now, who we have once again made vulnerable during this period of time. And we must be doing everything we can to continue to protect them. So I'm going to turn over to questions.
Okay. First, we have Kyle Kaminsky.
We can't hear you, Kyle.
Nope, we still can't hear you. You're unmuted on my end. Oh, David Ackerley?
Okay. Oh, by the way, Amanda, it's Dave, but okay. No, that's okay. It shows up with that. I know it comes over like on the email. Linda, question for you. First of all, City of Las Vegas, that was the Petri dish. If he's not in the City of Las Vegas, he may be okay working at that Lowe's. So
he's in Henderson, which is essentially the suburbs. And when you get the Petri dish right in the middle of it, and then everybody goes to their
that's true.
communities, it's like, there you go.
True. That's true.
He's close enough.
The state list with 4 as of yesterday congregate facilities in Ingham with COVID. Now you had mentioned before Bertram Hills. You had mentioned Ingham Medical on Dobie Road. Do you know the other two facilities where we have cases?
Yeah, Vista Springs is one of them. So Vista Springs is actually, it's listed as a facility that had an outbreak. The last positive case we had out of Vista Springs has been weeks ago, long outside of the 14-day period. It's listed, but that outbreak seems to be stopped in its tracks. Amanda might have to fill me in on the other one. I don't remember right offhand where the other one is.
I missed that. I'm on the chat, so I missed the question. I'm sorry.
Oh,
go ahead.
What is our fourth congregate facility that has an outbreak? We got Vista Springs, Bircham Hills, Ingham Regional.
I can look.
You know what? It's supposed to be in my email, so we're going to get that for you, David.
All right, thank you.
Dave, excuse me. I know to call him Dave.
I changed your name to Dave, so to help us.
Yeah, the email I had yesterday was Ingham Medical, Bircham Hills, and Vista Springs. So I am unsure what the fourth is.
Yeah,
the state
site says as of 4/23, Ingham had 4, and it said congregate, and I don't know if that includes a jail setting, if that includes incarceration.
Yeah, our jail, we're holding out well in our jail. No cases so far in our jail. We've been quarantining people on their way in to keep them separate from the regular population since the beginning. Right. And right now we're actually, now that we've been able to do some asymptomatic testing, we are actually testing people on the way in.
Would that also be considered under the GEMS unit? Would that be considered hospitalization? For McLaren, for their gerocyte.
You know, it could be. I don't. Right. Yeah, I don't know. Okay. I'd have to. I don't.
Okay.
And Kyle was able to type his questions in the chat queue, so I'll read them to you. He says, I'm curious how Linda is interpreting the governor's order on face masks. It appears that all essential workers and the customers that frequent the business that remain open, provided that they are indoors, are required to wear masks starting Monday. My question is that how you view this? And if so, how can that be enforced given that a violation appears to carry no criminal?
There's no fine, there's no penalty. So, yeah. So that is my understanding of it. In the, you know, like anytime, like if you're an essential worker and you're not doing the person-to-person thing, then you don't have to have a mask on in the workplace. So it really has to do with, you know, are you alone in there? How far are you away from other people? That sort of thing. So that's not a public setting. So that's kind of up in the air. But that is how I read it. It is, there's no fine, there's no penalty, so there's no enforcement. The fact of the matter is that as a result, that's going to become a self-enforcement. So a store doesn't even have to turn people away if they come in without masks. That's going to be up to them. So they clearly can now. They can say, nope, you have to have a mask, you can't come in. Or, you know, they can not. Their employees certainly will have to be wearing masks. But without a citation, without an enforcement, without a penalty, without anything, it just is there being required.
And he also asks as a follow-up, do you think that businesses should refuse service to customers who don't wear masks?
I think that is their prerogative to do so, yes. I think businesses need to have all their employees wearing masks under this order. That is something that I think, employers are going to probably be held a little bit more accountable to, especially from the public that goes in, that says, wait a minute, your employees are not wearing masks, and so they're going to have that pressure on them. They certainly can. Certainly, under an order which says it's required, they probably should. Whether they will or not, I do not know.
Okay, next we have Blair. Blair, go ahead.
Can you hear me?
I can.
Okay, good. About today's orders, there's a little fine gray area on what businesses should be open or not. We know about like lawn care facilities and certain like small businesses with curbside pickup, but there's still like an ambiguity about what kind of businesses can be open. Do you have an idea?
I haven't read the entire order yet. My guess is that a lot of the businesses that can be open, other than the specific ones that she mentioned that could be reopened, are listed in the order just as they always have been before, which means we've always had to some degree this ambiguity. And I kind of skimmed through the order looking for all of the important changes and have not been able to. I've been in meetings all afternoon, so.
Okay.
Yeah.
Okay, and I have one more question about that. What is your opinion about like the amount of orders that were given today? Concerning the mask, the whole overall.
What's that?
Overall, the governor's new orders today. Your overall opinion.
Well, one, I believe that, certainly our numbers in the region, in the county, are showing that we aren't pretty much we're in a very safe place in terms of reopening, because our numbers, like I said, until we get these testing numbers for the days that I was not able to show you to see what's going on with percent positives, in case a lot of those numbers are as a result of increased testing, it's going to be hard to tell where we're trending. So we've got to get that data in and take a look at it. But I do think that, we are at grave risk of reopening and immediately just having, another wave of this come through if we don't extend, a little bit. So that clearly is something that I can agree with, as hard as it is. I do believe that the opening of golf courses and, the ability to go into garden centers and things like that, a lot of low risk type businesses are appropriate to open back up. I think that, we need to start doing that, in a strategic, targeted, stepwise fashion, and there's no reason not to do it within the constraints of the order that exists right now, rather than, okay, we're going to reopen now, but only this. So what she did was she maintained the order but relaxed some things. What you're going to see after the stay-at-home order goes away is opening, but even opening is going to have some of that gradual rollout. You probably will not see bars and restaurants open at the very beginning of when things reopen. You definitely will not see mass gatherings, sports events, festivals, concerts, those sorts of things in the early stages of reopening. So, that's where we're going to go after we end this stay-at-home order. The masks, Burl and I have gone back and forth on masks for a while. And there are a lot of things about masks that I support. And at the same time, I have concerns. I've already got some of my healthcare professionals out there very, very concerned about what's going to happen with medical masks. So that is a concern. The emphasis is in there that don't buy the medical mask, but you can't control people and what they're doing. So that's going to be a concern and something to watch for as we move forward. I also think it's absolutely critical that people understand how to wear these face coverings, these cloth face coverings that were never meant to be some sort of a medical mask. And that means there is a way to take them off that's safe. There is a way to put them on that is safe. The mask itself on the outside, in every source you have seen, including a graphic, is going to be contaminated. If you touch it, you have a contaminated hand. If employees are wearing it all day long, as opposed to a person that might be wearing it for 15 or 20 minutes. I mean, everybody should be washing and decontaminating, and comes back into the work the next day with the same mask that hasn't been washed, then that becomes a concern as well. So it's very, very important that we just keep hammering home the message about appropriate and inappropriate wearing of them. You see people with them under their noses. You see just all kinds of things. And, none of that is actually accomplishing what it is intended to accomplish if you're not wearing a mask properly, if you're putting it on improperly, if you're taking it off improperly, if you're touching it, and if you're not cleaning it regularly. So we have absolutely got to get those messages across. So.
Okay, thank you.
Next we have Burl Schwartz.
Hey, Linda. Yeah, I want to continue in that vein because it seems like what we have now is governor taking us right up to the edge of requiring masks, but since there's no enforcement, you can't really say it's required. And yet you're saying we got to be really careful about how people wear these things. And it wouldn't it have been better to either say you got to wear them or you shouldn't wear them, but this sort of in between, isn't this just going to be confusing?
Well, yeah, it's not confusing. What it is it's required, but since it's not enforced, that means people are still pretty much free to do what they want to do. What it does allow is a customer like yourself to say you're supposed to be wearing a mask, and who knows whether that peer pressure, accomplishes anything or not. It also basically
May I interrupt you on that point?
Yeah.
So, I say to somebody, you're supposed to be wearing a mask. And then do I say, but be really careful on how you touch it, et cetera? I mean, it just seems...
No, I'm not asking you to do that. I'm
Right.
telling you that we as public health officials, we as government that are out there now requiring these masks also have to make sure that that people know that there are inherent things about wearing a mask that can be problematic with regard to infection control if they're not done properly. So that's not your job, right? I'm just saying that.
No, I was thinking it makes your job more difficult.
Yeah, that has long been one of my concerns with them, as I've told you.
So is this step she took today, did it just make things more difficult for you?
No, it made things about the same for me, honestly. I'm still concerned about the way people wear, because I've seen it. I've been out there, underneath their noses all over the place, touching them, taking them off, gosh knows what. I don't know whether they washed them or not. That's bad. The virus will linger on the outside surface of that mask for prolonged periods of time if somebody actually has the virus. And then you're creating a viral load on the outside of it if it does not get cleaned. It must get cleaned. So we're just going to keep hammering that message. There's no enforcement. I think I understand why. Our law enforcement folks do not have the time to go out and be the mask police, and they are the enforcement arm of things right now. So I think that's probably a big reason why we didn't get into the enforcement part. I will tell you that one of my concerns with it is that we're going to have some, what do you call it? When people kind of get into a little bit of a fight, a scraffle, or whatever you call that. There's a word for it. People will be in grocery stores and will be angry at the people who are not wearing masks and start bullying them and this and that and the other. So the store decided, I'm not going to exclude you because you're not wearing a mask, even though it's required. So then we're going to have a bunch of angry people yelling at each other and all that sort of stuff. And that is also probably, you're basically leaving people to self-enforce it is what's happening. You're leaving store owners to say, I'm going to turn you away if you don't have one on, but you didn't tell them that they had to. And then you're leaving people that go in to start pointing fingers at each other saying, you're supposed to be wearing a mask.
So it sounds like it made things more difficult, not better.
It brings a different set of challenges, right? Now it brings a different set of challenges. So I do think that in general, when people go, for example, into Meijer, I see people, all over Facebook, and they're angry. They're angry when they go out to stores and people aren't wearing masks. And this was before they were required, right? Like, oh my gosh, I went to the store and half the people there weren't wearing masks. I think they probably will start to become vocal in the era of requirement. And that probably will have some impact on getting people to wear them, and probably will have some impact on them advocating and lobbying at the stores that they frequent to insist that managers say, we're not letting you in unless you are wearing a mask. So unfortunately, Burl, I think we've turfed it somewhat to the public to enforce, and to those of us who are, in the business of, enforcing, because, I do that when I go out. If somebody's not following a public health order, I will point out to them that they're not following a public health order and that they, so if I see, matter of fact, I just kicked somebody off of a golf course last week. So it's like, you're not supposed to be on the golf course. They were like, well, nobody's doing any harm here. I was like, the golf courses are closed. The next was, well, we're just walking the dogs. I said, well, isn't that a golf club in your hand? So,
Thank you.
Okay, Dave Ackerley.
Linda, there was an interesting story today in the Miami Herald. In the state of Florida, Miami-Dade Health, working with the University of Florida, they were doing these, drive-through testing, but not just for to see who had it, but they were testing to see how many people might have the antibodies. Their story, they're saying that 6% of county residents are seropositive and have had the coronavirus here at some point, meaning that's about 15 times the official count in the county. Could we be looking at the same thing in Ingham County, and being this close to Detroit and other places that have had severe outbreak? We have a lot more people who've come in contact, got it, and never knew it, or it was so mild, or they were asymptomatic. Is that something we'd be looking at here? What are your general thoughts on that?
I have no doubt that if we did some sort of antibody testing, that we would find that there are more people in this community that had coronavirus or COVID-19 than we have counted. That there's no doubt about that. I mean, if you go back to the early stages of it, when there was, when we weren't continuing to expand testing, it's like, if you had mild symptoms, just stay at home. So we had a lot of people with mild cases of it that didn't necessarily get tested. We also know that there are people that are asymptomatic, but I will tell you that the antibody testing right now is very, very early. It has some promise, but at the same time, it's, it's early, it's under an emergency use authorization, and it is requires a physician to interpret very well. I mean, right now, our Michigan Association of Public Health Physicians, Preventive Medicine and Public Health Physicians, have got a position on the antibody testing that is kind of like, well, yeah, it's out there and it's being done, but there's a lot of those results that are difficult to interpret. There's a lot of those results that, we're all over the map with antibody testing right now. So I would not hang my hat on antibody testing at this stage in this outbreak and in the development of testings to monitor the outbreak. The antibody testing is behind the actual current infection, the testing that detects you during an infection in terms of its reliability and validity and all of that. So while it's interesting, I don't think that it is actionable in a grand way at this point in time. Because we also don't know what it means. What kind of immunity does it confer? How long does it last? How long does it take you to get there? Those sorts of things. So, you're doing antibody testing and then it's like, well, now what do I do with this information? So, those are good studies to be doing right now, but eventually we're going to have to pair those studies with some studies of the tests themselves to see how good they are at actually detecting what they're supposed to detect, as well as what that information means when we kind of sort all that out. So.
All right, thank you.
Mm-hmm.
Okay, go ahead, Burl.
Linda, if the zip code 48911 continues to lead Ingham County in the number of cases, is there something going on in 48911 specifically, or are there general causes you can point to?
Well, remember, look at the rate map as well. So 48911 is a more densely populated area, right? So they've got more cases because they've got more people, in part. So that's part of it. If it's more densely populated, they're probably a little bit more crowded. We probably have more crowded housing and other sorts of things that are going on in 48911. We'd have to look at a lot of demographics of 48911. I do think it, compared to other places in the county, it has a higher percentage of African Americans, higher percent poverty, and some other things like that. that are going to contribute to that fact. So, especially when we know that, again, you're probably looking at a population of people that are out working right now rather than staying home or telecommuting. So that is part of it too, although we have that in other zip codes in the county. So we're actually, in the process of digging into all of that and getting messaging going and finding out some ways to address that. But, it's always, it's always hard to do epidemiology and demographic work around epidemiology while you're in the middle of an epidemic. They're always easier to look back on and see, oh, that's why that was. And then we tend to fix problems after the fact. But it's all tied up in all that socioeconomic factors that I talked about earlier.
Would you know at this point if there were a particular hotspot in 48911 where cases are emanating from, as opposed to generally speaking, it's happening in 48911?
Well, 48911 is a pretty small, it's not a huge geographic area. So yeah, we could. I don't know that we've looked at our map. I haven't had my epidemiologist give me maps that way in a while, because early on it was like, well, we've only got one case in that zip code, so I can't lend a dot on the map because that has the risk of, disclosing protected health information kind of thing. So we don't do that. But, we could certainly do that with a few of our zip codes at this point in time. So that might be interesting to look at. Thanks, Pearl.
Okay, thank you.
Rachel Sweet.
Hello. I know you mentioned the antibody test and that it's too early to tell, or they're kind of hard to read. So will there be tests here in the Lansing area? I know they're going to be coming to Brighton, but just wanted to know if it's going to be coming.
Antibody tests?
Yeah.
Yeah. Like I said, it really is going to depend. Our statewide association of preventive medicine and public health physicians are kind of, in a very cautious mode with it right now. So that's kind of a statewide perspective. Again, what happens in different areas of the state can vary depending on how much, a medical director in that particular area either agrees or doesn't agree with the colleagues across the state. So I do believe, and I have a colleague that used to be my deputy health officer when I worked in Kalamazoo that is actually out in Orange County now. And they've had so they were earlier on in doing some of these antibody tests, and they've had quite a bit of problem with that testing as well. So the experience has been very mixed with it. So, you can do it, but it requires a lot of caution. And then it also we don't necessarily know what it means at this point in time either. It's like, okay, you tested positive for antibodies, how much immunity does that confer? What, that sort of thing. How long does it last? So what do the results of that actually mean, other than identifying for us that there potentially are more people that have had the virus than we know of, but with a high false negative, the false negative and false positive issue on them is very challenging right now as well. So
you don't know if they will actually be here, or they will be available here?
I don't know of any immediate plans to do that here.
Okay, thank you.
We are, sorry, I should have answered the question more directly. We are starting to do a good look at a little bit more broad testing, so like asymptomatic testing. So testing for current infection with the virus that may be asymptomatic, which you saw done at a homeless shelter in Boston, where they tested about 400 people and 160, some of them turned out positive, even though they had no symptoms. Similarly, a facility was tested. It was a nursing home. I don't remember where it was. And again, they found a significant number of positives in their sampling because they just tested everybody. Nobody had symptoms. They tested everybody, and they did find, again, probably a 20 to 30% at least group of people that tested positive in the absence of symptoms. So we're kind of going to go down that path for right now, because we're trying to control the current outbreak more than we're curious about, well, how many people might have had it? We need to focus on the pressing priority, which is how do we control the current outbreak? do we start identifying asymptomatic people so we can quarantine and isolate asymptomatic people and their contacts, and be able to do that moving forward. So that is a priority for us.
Thank you.
Next, I have a question from Kyle Kaminsky, which he submitted via chat, so I'll read it to you. It says, I think 9 deaths is one more than our last daily report for Ingham County. Can Linda share details, any details about that person's age, gender, and location?
So actually we had a 9th one yesterday. So we were up to 9 yesterday. So that is not new today. I don't have my exact number. Let me see that 9th one. Got a call on that one. I believe it was a male in his mid-70s. He had traveled prior to coming back to the state and becoming. At the time he was tested, I understand he was asymptomatic. So then got tested, was positive, disease progression, and eventually ended up in the hospital in ICU on a ventilator and passed. So to my knowledge, there were not a significant number of underlying health conditions either. So 75, mid-70s, excuse me, male, travel history.
At this time, I don't have any questions in the queue.
It's Burl. May I ask one? It'd be interesting, I think, if we could get a breakdown for each individual who has passed away, just age, gender, did they travel? Would that be too much trouble?
So when we have low numbers, we don't disclose all of that individual information in any kind of consolidated way, because again, you don't have a big enough number to really demographically assess it for anything specific going on, because it's too small. 9 is despite the fact that it's tragic, it's obviously very tragic. And we, on Monday we had 6, I think Tuesday we had 6, and then before it was 7, 8, 9, just like that. So we will get there, but we're kind of waiting for some of that, demographic number issue to smooth out to where we can do it in aggregate. We would rather do aggregate reporting. It is better from a public health perspective to do aggregate reporting, not individual case reporting, because that starts to get really on the fringe of disclosing protected health information. And though it doesn't seem that it would, what happens is, the neighbors, the friends, the whatever of that person then see it. And then they go, oh, that's my friend so-and-so. And then they start, and then before you know it, they're pointing fingers all around and saying, I know that person because they gave this information and this information. And then it becomes disclosed to the public, and we have to be careful about that.
Also, are the 4 people who are still in the ICU, can you tell us, are they all on ventilators?
That I don't know.
Okay.
I don't know.
Thank you.
The one that just passed was on a ventilator and in ICU.